The holidays are tough enough, but if you're trying to weather that part of the year, which is not too far away, and you have a bad tooth, that thing that's just aching and bothering you the whole time, I have a place that you need to go and a gentleman you need to see. I'm at Dental ER on Primrose, right across from Kickapoo High School, and I have Dr. Wade Wheeler with me today. Good to see you again, sir.
You as well, Tom. Welcome back.
Thank you very much. I appreciate that. And I'm not kidding. Any time is, but when you get to the holidays and all the rush and hustle and bustle, having something nagging at you like a bad tooth is...
no fun.
It's awful.
It's no way to live during the normal time of year, but
Yeah.
holiday season with all the pressure and everything going on, it's easy for people to put it off because there's so many other things to be done. But if you put that off, all you're doing is shooting yourself in the foot because you just ruin your own holiday.
It gets worse and worse.
Worse and worse.
A bad tooth does not get better on its own. Okay, now I know your whole philosophy is pain stops here. And because of that philosophy, you're a little bit different than the average dental office.
That's correct. We're available essentially anytime you need us, Monday through Friday, obviously. But we don't book people out weeks at a time. We'll get people in the same day or the next day if they call and have a problem. That's our whole shtick. Is we like people to be feeling better as soon as humanly possible.
Now, in all honesty, just a few minutes ago before we started doing this, gentleman walked in. You're going to take care of him. Walk-ins, how does that all work? People can just walk in and ask for help?
They can. It's best if they call first because you never know how crowded we are. If you walk in off the street and there's 15 people ahead of you,
Sure.
you're just waiting. But phone call's good, but walk-ins are welcome. We'll take them. We operate 9 to 2. We take our last patients at 1. So if you're going to walk in, try to be here before 1, and we'll get you fixed up. We're not going to send anybody away.
What kind of services do you offer?
99% of what we do is getting out bad teeth because 9 times out of 10 when people are in pain, they've either got a tooth that's infected, broken, something like that, and if it needs to come out, we'll get it out. If it does not need to come out, we can get you on antibiotics and pain meds and get you in touch with the right people to do the treatment necessary to be able to restore your tooth and get it back to health again.
But what the whole idea is what I said earlier, pain stops here.
That's right, get you out of pain.
What kind of age range do you work with as far as, kids all the way to grown-ups and seniors?
Well, I will see kids, young kids, as long as they'll see me. That's the key. If the kid will tolerate it and work with me, I don't have a problem working on kids. The variable there is the child and the parent.
Sure.
If they're willing to do what's necessary to get the treatment done, I'll treat them.
But that's also something we were talking about. If they're willing to have it done, that's something I think children need to understand, all the way into your singles and teens.
Yeah.
This is totally different than what you may see in a movie. That's a whole effect that's different.
That's correct.
If pain stops here, it's not going to start here either.
Absolutely, absolutely. We do our absolute best to make a bad thing bearable. And we routinely have people tell us that this was way easier than they expected. And it can be, but with kids, they have to understand that, and that goes back to the parent laying the proper groundwork with, you're going to be okay doing this.
Sure.
And if they come in and don't already have their mind made up that it's going to be bad, I can get people through it and have them be pleased.
Well, and of course, we're talking right now about children, but it goes into adulthood too.
Absolutely.
We have a fear that's many times unfounded.
Absolutely. Well, I wouldn't say completely unfounded because there's a lot of people out there that have had some bad experiences in the past.
True.
But for them to take that experience and apply that to every dentist out there is an unfair deal. And all we ask of people when they come in and they're in pain and they want to get better is just give us a chance to show you what we can do and how bearable this process can be.
Well, and bearable, that makes it sound like bearable, but in truth,
I'm not going to sugarcoat this,
Well,
Tom.
no, I understand. You're not sugarcoating, but this is not your dad's dentistry. This is not your grandpa's dentistry.
Absolutely.
A lot of advancements have happened here.
Yes, we've got modern day anesthetics that are way more effective than the old-fashioned Novocaine. Everybody calls it Novocaine, but no one uses Novocaine anymore. Stuff nowadays is so much more effective at providing good anesthesia. that, it's routine for people to look up at me and go, "We're done."
Yeah.
And yeah, we're done.
I've done the same thing in all actuality. Okay, just maybe a quick piece of advice for folks who maybe having that tooth and maybe they can't come and see you right away, but they could the next day. Any advice on that nagging toothache?
How to get it to get themselves by until they can get in?
Right.
Apply ice. If it's throbbing and pulsing, ice is always better. Head elevated, and then alternating Tylenol and ibuprofen is a good over-the-counter method to keep people comfortable until they can get in to see us.
All right, and as far as getting in to see you, how do they get in touch with you?
417-851-8111 is our number. 222 East Primrose, across from Kickapoo High School, like we talked about.
Right.
And Dental ER, we're on the web. Look us up.
Pretty
Call us.
simple.
Come see us.
All right, you want to come and see him. You're having that bad toothache, even if it's a nagging toothache, you want to get it taken care of. You want to think about Dental ER because pain stops here.